Hi everyone, this is Dr. Stefan. Welcome to interstitiallungdisease.info. In this episode, I'd like to discuss about what can you avoid if you have pulmonary fibrosis in order to prevent the decline of your condition or to at least delay that progression as much as possible. So this could be in your case, or if you have a loved one who is suffering with a form of pulmonary fibrosis that is progressive in nature, what can be done? So there are a couple of things that I'll touch upon. I won't waste too much time on introductions. So basically, the first thing that you can do, if you are still smoking, please stop. So this is one very important thing. Of course, if you are smoking, you are not helping your lungs at all. And I know that it can be very, very hard to quit. That is something that I have a lot of sympathy for. It's very, very hard to quit smoking once you've done so for many, many years. And actually, there are many programs out there around the world, wherever you may live, there may be a program that will help you quit smoking. So it's important to inquire with your family doctor, with your general practitioner, with your respiratory doctor, your pulmonologist. What are good ways to quit in your case if you are still smoking? I'm not just saying that it's easy and just stop tomorrow. Try to think about ways to reduce smoking. And it's very important to think about associations that you have with smoking. It's an addiction, and it's important to treat it as such. It's a social addiction in the first place because you may smoke together with your friends. So giving up smoking may mean that you're losing some of your social circle. So you need to find ways to cope with that. How can you socialize without smoking? You need to think about ways to do that. You may have a psychological addiction to the nicotine itself. You may have associations, for example, related to smoking a cigarette to cool down the nerves, to calm down. So you need to maybe find better ways to cope with that. So these are things you need to work with. And at the same time, a lot of people associate smoking a cigarette with their morning coffee, with their commute, with driving. So trying to break these habits can actually go a long way to quitting smoking for good. Also, important to note that it's a physical addiction as well. So you will have a lot of cravings if you are trying to smoke. So of course, trying to break these cravings can be difficult, but there are treatments for that. So there are pharmacologically pure forms of nicotine that you can use in lozenges, gum, patches, etc. So generally, these can be prescribed by a smoking cessation expert or your doctor or someone who knows what they're doing. Generally, you would need some kind of a slow release nicotine to give you a baseline. So this could be a patch. And then you may, when you feel the craving, despite having the patch on, you don't light up a cigarette, but you maybe take a lozenge, or there can be an inhalator that gives you a little bit of nicotine, but in a pharmacologically pure form rather than smoke. And this can help you combat those cravings. So this is just in brief what smoking cessation strategies may look like. There are treatments sometimes that can have an mild antidepressant effect, which have been shown to reduce the cravings for people who have problems with smoking. But I focused a lot on smoking. What else can you avoid? So you may not be a smoker, but if you are, for example, working in a very dusty environment, you're exposed to a lot of fumes in your work, things like that. Trying to reduce these exposures can go a long way to reducing the injury to the lungs. So you may consider wearing personal protective equipment. So this could be N95 or FFP2 masks if you can get these while you're working in the dusty environment. But the better thing would be to work in a well ventilated environment, or to change jobs potentially if nothing else works. I know that can be very, very difficult, especially if it's your livelihood and you've been, for example, been dependent on your job for your income, for your family's well-being. It may be hard to stop, but it's important to think about long-term health as well. So I know it can be difficult. I'm not trying to patronize anyone. I'm not trying to say that you should quit your job if you have pulmonary fibrosis. But if it is affecting your health, you need to really, really balance what you're getting from that workplace, continuing in that workplace that you've been used to working in, and your health. So just making that judgment for yourself can be really, really important. The other thing would be to think about indoor pollution. So I did mention this before in a video, but I'd like to touch upon it here as well. There's lots of things around our house which are forms of pollution. So the easier one would be if someone is smoking inside your house with with closed windows in a closed room. probably that's not going to be good for your lungs. So you may ask them to try to do that outside, or just open the windows to make sure that you're getting fresh air. You may also be using stoves for heating. You may be burning wood or coal or things like that inside the house. Make sure that your stoves are really sucking out the smoke well, clearing the chimneys every year, making sure that everything's working well, using extractor fans in the rooms where the stoves are operating. Well, when they're not on, of course, because that would probably drive the smoke back into the room. So just being mindful of how you are clearing the air in your room to make sure that you have fresh air inside the house. That's important. Also think about other more innocuous things like burning incense, burning candles, all kinds of things that can produce smoke inside the house and particulate matter. And for that matter, you would also may want to think about using spray on deodorants and hairsprays and things like that. If you do use them, maybe use them in the bathroom and then open the window or walk out after you've used them so that you're not really breathing in those vapors, because they may worsen things. There's no evidence necessarily for all of these things, but if you feel an irritation when you're breathing something in, potentially it could be bad for you. So just keeping that in mind is important. The other thing around the house would be to be mindful of damp, condensation, mold. If there's any of these around the windowsills, in your bedroom especially, places in your living room, places where you're spending a lot of time, maybe try to see if there's a way to fix the humidity problem, because you don't want to be inhaling fungal spores. That's probably not going to lead to very good lung outcomes. You are adding an extra challenge to your lungs, something that they need to clear. So obviously, if you're inhaling those fungal spores, in most people, you will not get illness from that. But your lungs will need to work a little bit harder. So if you're already struggling with a lung condition, maybe not adding more to that would be helpful. And in some cases, it can actually be related to the cause or trigger for your condition. So just bearing that in mind is important. If you are sensitized to birds, I've mentioned this in a few other videos, some people can be sensitized to bird proteins. So this could be things that are released, little bits of dust that are released from feathers, birds flapping their wings, birds being up and about, bird droppings, things like that. You may need to stay away from these things if you have a sensitization, and your doctor can actually run blood tests to determine if that's the case. If that's the case, it may be a trigger for your condition. So removing those exposures, which are microscopic in nature, so it's important to note that. So for example, if you've been keeping birds inside the house, maybe you're having a budgie, or maybe you have an aviary and you're cleaning the aviary, and that has triggered your lung fibrosis, it's important that you should be cleaning the environment, but not by yourself. So if you are triggered by bird proteins, sometimes people are told by their doctors, you need to get rid of the birds. But if you're getting rid of the birds around the house and then you want to do a deep clean of the house, imagine that when you're doing deep clean, when you're dusting, when you're vacuuming, when you're clearing everything out, you may actually get a whole load of exposure just by doing the cleaning. So in those circumstances, it might be helpful to actually ask someone else to do that for you, because you don't want to be exposed to these microscopic little particles if you are sensitized to them, because it only takes a little bit to trigger inflammation in the lungs. So obviously hard to get rid of completely, but important to think about. And then the final thing that I would talk about in this video, if you are struggling with acid reflux, so gastric acid moving up, try to think about treating that to avoid having a lot of significant acid reflux, because it's been shown that it can worsen the lung scarring, lung fibrosis. And that treatment can be done with tablets, anti-acid medication prescribed by your doctor, but also it's important to consider diet. What are you eating that is causing the acid reflux? If you can maybe adjust your diet somewhat, maintaining a healthy weight so that you're not carrying a lot of extra weight on your stomach that will push up the acid when you're sleeping especially. And then when you're sleeping, trying to not go to bed with a full stomach, because that will worsen the acid reflux, avoiding acidy, spicy foods in the evening. If you like spicy foods, maybe eating those earlier in the day. And then also while you're sleeping, imagine that if you're completely flat, that may worsen the acid because it may find it easier to come up, against gravity. So There are some triangular shaped wedge pillows that you can buy online or in specialty shops, and they can lift up your torso maybe up to a 10 to 15 degree angle, and that can actually help somewhat with the reflux at night. So these are just a couple of things that you may want to consider avoiding if you have pulmonary fibrosis. Of course, it depends from person to person, but I think it goes a long way if you are avoiding things that worsen your lungs. Hopefully this was helpful. If you have further questions, leave them in the comment section below, and I'll try to answer them in future videos. All the best.